I'm Lucy Ashton. I'm Head of Charity for the Royal Devon Hospital charity. And less than 18 months ago, we launched one of the biggest appeals we've ever done, the Super Theatre Appeal, to raise £1.4 million for new hybrid equipment for our vascular operating theatre here at the RD&E in Devon. I am so proud of my team and our wonderful community because we can now say we have done it. We have hit that target and the operating theatre is now open. I now get the lovely honour of being able to go behind the scenes with Hannah Travers, who is one of our consultant vascular surgeons, to see this amazing space. So here I am with Hannah. Hannah, thank you so much for taking the time to show us around your wonderful new operating theatre. I'm very excited to get this behind the scenes. Before we go in, just for the majority of us who don't understand, can you explain what a consultant vascular surgeon is?
So a consultant vascular surgeon is someone who deals with the blood vessels anywhere in the body apart from the brain and the heart. So you have arteries that take the blood away from the heart to all the organs, to your fingers, to your toes, and you have veins that bring the blood back from those areas and back from your organs, back to your heart. And we deal with narrowings or blockages or where the blood vessels become a bit too big anywhere in that system.
So can we go on in?
Yes, we can, but first you need to put some scrubs on.
There we go. There we go. So, should we go and have a look inside?
Yeah, would you like to do the honours?
I would love to do the honours. Wow, this is so exciting. It's so lovely and bright.
It's bright, it's spacious, it's everything we ever hoped it would be.
So, we called this our Super Theatre Appeal, but I've also heard the word hybrid used quite a lot. So what is a hybrid operating theatre or a super theatre?
So it's easier to start with what a standard operating theatre is. So in a standard operating theatre, you have your anaesthetic machine, which is behind me, and you have a normal operating table, okay? And the patient will come in from the anaesthetic room, be put to sleep, and then have their operation. Now, a super theatre has lots of additional kit. As you can see, there's a huge amount of kit around us. And that enables us to use high-tech imaging techniques as well as performing open surgery. And that's where the hybrid component of it comes from. So we do traditional open surgery combined with imaging techniques, which is known as interventional or endovascular procedures, to improve the blood supply for patients.
So talk to me a little bit about some of these pieces of equipment that we have funded through the appeal, because I can see some big pieces of equipment in the room.
So these hanging from the ceiling are the lights. So a standard operating theatre only normally has two, but because of the type of operating that we're doing and the versatility of this theatre, we've put 3 lights into this operating theatre. The biggest piece of equipment which makes it the super theatre is our C-arm. So this is ceiling mounted, and that produces X-rays. It can also produce a CT scan if we need to during an operation. It runs on the tracks on the ceilings and allows us to take pictures of any part of the patient's body whilst we're also operating on it. Those X-rays are taken and the image gets projected onto the big screen behind you so that we can see exactly what's going on and what we need to treat. We've got some more TV screens over there which allow us to see both the main image that's being projected from the live imaging that we're taking, but we can also have the patient's previous CT scans or their EPIC observation charts or any other static images of scans displayed all at the same time.
What's the difference for me as a patient for you having this theatre?
Often patients would either have to have 2 separate procedures where they have the open surgery in a standard operating theatre, and then either before that procedure or after that procedure, they had to have another procedure downstairs in our interventional radiology suite because we couldn't do it all at the same time. Occasionally, we used our interventional radiology suite as a theatre in itself, but that causes delays for other patients who just need an interventional procedure because it takes out a huge amount of time. So having this theatre is a complete game changer in terms of the number of procedures that patients have to undergo, which then affects their duration of being in hospital and their recovery. We can also use new techniques and other procedures that we couldn't do before because we didn't have the imaging technology within the theatre space. we absolutely love it up here. We've got space, we can have all the kit that we need, we've got lots of storage for all the additional kit that's required, and everybody wants to come in here and work. It's really exciting.
I'm interested, have you had any standout cases for you that just really reinforced why we've built the space?
Well, vascular surgery, we are using it all the time and able to treat patients at any time of day or night in the environment they need to. Christmas Eve is an example of that, where I was able to treat a patient with a stent to repair their aneurysm, and they went home on Boxing Day.
Wow.
Ordinarily, that would have been a big operation, which they probably wouldn't have survived. And if they had survived it, they would have been in intensive care for a minimum of 3 to 5 days, and then on the ward for another week or 10 days. Wow. So this is an absolute game changer. Talk about the best Christmas present ever for that patient and his family. But we've got lots of other teams who are using the theatre out of hours as well, for patients who are bleeding, and we have to stop that bleeding through the imaging techniques when they're unstable, very sick and unwell. ITU is just around the corner. They can come in here and have the treatment that they need, rather than being wheeled through a lift downstairs through the corridors to the old interventional suite.
And how far might people travel?
So as a vascular service, we treat patients as far as Dartmouth, who come in through the Torbay service into us.
Yeah.
And from our renal access population, they come as far as Bridgewater, Ilfracombe, North Devon, and out as far as Lyme Regis. So it's a huge area of Devon that we cover with our vascular service.
What kind of conditions might someone have?
So the majority of our work is for patients with atherosclerosis, which is furring of the lining of the arteries. And that's the same disease process that can cause heart attacks or strokes, but it can also cause narrowings and blockages in the arteries that supply the blood to the leg. So a lot of our work is improving those narrowings and blockages, either by doing bypass surgery or by using wires and balloons and stents, using the imaging system to open up those narrow blood vessels. And more often than not for our patients, it's a combination of the two, which is why we needed the super theatre and the hybrid theatre, because we can treat all of that disease in one go. The other element of our work is patients with aneurysms, so where the blood vessels in their various parts of the body become bigger than they should be. And sometimes we need to fix those to reduce the risk of complications from those aneurysms. We treat patients with diabetes, we treat patients with renal failure, and being able to do these operations means that we're saving legs, we're saving lives, we're giving people access to have life-saving renal replacement therapy.
It's great for the staff and for the team, but what impact has that made to the wider trust?
So this is an additional theatre. It's not a conversion of old theatres into this new super space. It gives us 11 active theatres in our main theatre complex, which has moved vascular surgery from our old theatre, Theatre 5, into this lovely new theatre, Theatre 11. Now that Theatre 5 is now being used by other specialties who are treating patients with cancer, who are treating other serious life-threatening conditions. So it's given us that extra capacity, and the fact that it's a whole new operating theatre, which is helping to reduce waiting lists across the board. But also, because we're treating patients in one sitting, we're able to get them out of hospital faster, which gives us more bed space to again help flow for emergency patients coming through the door in the emergency department, and for our elective operating.
And I know it's really important wherever possible to get someone back in their own bed. The best bed is your own bed, right?
Absolutely.
So I'm interested in this, Hannah, because this is obviously looks like a really big, important piece of kit. How does the C-arm move? How does it move around the room?
So it's controlled by our radiographers, who use the control panel in the corner, which that can be moved anywhere in the theatre space to enable them to move this C-arm. This C-arm runs on the tracks, but actually has many degrees of rotation and angulation to give us the best views for the patient. But if you see the blue markings on the floor, that is actually the area of space that this C-arm will move through to enable to get pictures. So if the patient's body part is positioned anywhere in this blue space, we can take a picture of it. Okay.
Brilliant. And talk to me a bit about the bed, because it looks very narrow to me.
So this is one of the big pieces of kit that the charity have funded for us. So we have an interchangeable operating table. So the most operating theatres have a table that can come in and out of theatre and be swapped as required.
Yeah.
This table is different because it's solidly mounted to the floor and communicates with our imaging system. So it knows exactly where the table is in relation to the C-arm to avoid collisions and to make sure that we get the best pictures. But the top surface of the table can be lifted off, placed on a storage trolley, and a different operating table brought in. This table that we've got on at the moment is our interventional table. So this is a solid piece of carbon fibre underneath, which allows the X-rays to travel through so that we can take pictures of any part of the patient's body. And we'll position the patient relative to where we need to take the pictures. Our other tabletop is a standard operating tabletop, which actually has lots of joints and hinges in to enable us to position the patient in the correct position for the operation, but has additional components that still allow us to take X-rays. But this solid carbon fibre piece gives us the best options for all our imaging.
So talk to me about some of the other bits of equipment I can see in the room. What about the screens and things?
So these hanging from the ceiling are LED screens. We've got 3 of those. So although they're completely clear and see-through, they are LED lined, and we position these between the X-ray tube and the staff when we're doing the procedure to reduce the doses of radiation that we get. We've also got a LED screen that's attached to the table, and we've got a second one of those that fits on the other side. And all of that contributes to reducing the dose of radiation to our staff. So this theatre has a much lower dose of radiation for all our staff than using a standard C-arm or in other theatres where they don't have all this additional protection.
Can we see some of the other spaces? Because I know that this is obviously the main operating theatre, but I know that there's a lot of other really important spaces.
So this is the entire theatre complex, but from a staff point of view, we come into the scrub room, as we call it. So you'll have put your lead gowns on, which I'll show you in a bit.
Yeah.
And this is where we wash our hands and put on our sterile gowns and gloves before performing the surgeries. So we've got our preparation room. So this is where our nurses store all our equipment to do the operations, and it's got a nice kit pad. So when you're sterile, you don't have to touch any doors.
I wondered why you were doing that with your foot.
This is where all our instruments for our operations are kept, and this is where our theatre team lay up the sterile tables before bringing them into theatre once the patients
all the
are
pieces, there. Yes, I can see that, nicely labelled.
Yes.
So little things like the kick, that's really clever forethought in what the space needs.
Yeah, so that's part of the design process, and the luxury of being able to build a theatre from scratch. We could think about all these little things that actually make the workflows and the day run more smoothly. So this is our anaesthetic room.
I love the ceiling panels, just that.
Yeah, so that's an additional design that we put in because actually it makes a real difference. This is the bit that the patients will remember, and often they're very anxious. They're about to have major surgery. The team are brilliant at trying to reassure them and keeping them comfortable. So if we could, whatever we could do to make it a more relaxing environment, and we felt that the skylights really make a difference. It's also lovely for the staff because actually we don't have any natural daylight in the space, but the design team have worked really hard to get the lighting as natural as possible, and this full sense of a bit of blue sky is always lovely even on the cold dark days. So I'll take you to the control room, which is a fundamental part of it being a super theatre. Other theatres don't have the control room.
Okay, that's interesting.
This glass allows us to see exactly what's going on in theatre whilst reducing the radiation. So if you've got medical students in here, or nursing students, or anybody who isn't directly involved with the procedure when we're using the X-rays, they can stay in the control room but still see exactly what's going on.
So do you use the space to do quite a lot of teaching?
Yeah, we have medical students from Exeter Medical School. As long as they're at university, then they're here with us. So yes, we have them all the time rotating through, but also our nurses, our ODP staff. We have lots of students rotating through from all levels.
What an amazing experience for them to be able to watch in real time.
So this is our control room.
So you've got students in here. Who else might be sat in here during an operation?
So it's used during the operation by students to observe, but they're invited in when we're not using the radiation, but to reduce their dosage, they can come in here. But actually it's before and after the procedures that this space really gets used. Or if we're, sometimes cases don't go according to plan and somebody might need somebody might come and help. They can communicate to us through the tannoy system into the theatre, but also they can review scans and review the imaging that's already been taken throughout the case to see what else we may need to do. So we've got a high resolution computer that allows us to see scans, and that's all linked into the trust.
So the scans that you're taking in there then will come through onto this screen?
They can come through on there, or any historic scans that they've had in the past in radiology. On other trusts, we can see Torbay scans, we can see Plymouth scans. So wherever else they may have had scans or imaging, we can look at those old scans as well. The kit at this end of the room, that's all related to the image processing from the pictures that are taken during the theatre. But if you need to perform a CT scan, actually all the staff would come out because the radiation dose is very high. They can watch the patient, monitor them from in there, and control the C-arm from this workstation as well.
So we've talked a lot about radiation and
yes,
the benefit of the screens for staff. My understanding is that the charitable funding has also funded these lead vests.
Yeah.
So talk to me a little about what these do and why they're important.
So these are lead vests and skirts, and they've also got thyroid protectors. So there's an amount of certain safety equipment that's required when you're using radiation to reduce the dose to the staff.
Yeah.
So we've talked about the distance, and we've talked about the fixed lead screens and the mobile lead screens, but actually everybody who's in the theatre whilst the radiation is turned on needs to be wearing a lead apron. We've got 24 sets of generic lead aprons in all sizes and different lengths to accommodate our varied workforce. And the consultants and the senior nursing team also have their own individually fitted lead aprons, but they're kept in our office to keep them safe.
How long might you be wearing one of these? Does it get quite hot?
So you could be wearing one for up to 6 hours sometimes longer. Yes, they get very hot, but the nurses do a great job of keeping them clean and washing them down. But yes, they can be very hot and uncomfortable, but they've got supportive back supports in, so to help reduce the strain on the muscles. And that's the reason for having split skirts and top as well, rather than a solid one-piece apron, because it distributes the weight over the hips and the shoulders better, rather than having it all on the shoulders.
So even these have been really thought about in terms of the ergonomics, in terms of the benefit to staff.
Yeah.
So it's not just the cutting edge of the big pieces of equipment you can see, it's the cutting edge of the smaller things that actually are really, really important.
Yeah, I mean, we really tried to make this the best operating space that we could for both patients and staff.
On average, what amount of time are you spending on when you're operating? What's the sort of shortest amount of time you might spend?
The shortest operation, if you include the anaesthetic time and the operating time, 30 minutes might be the shortest operation, but that can range to, on average, probably we spend between 2 and 4 hours operating on patients, but it can be 5, 6, 7, sometimes longer in very complex patients.
So you need a lot of stamina and endurance as a surgeon, but also I would imagine that cohesiveness of your team must be really crucial in how well you work together.
Absolutely, we work together. It's the vascular surgeons, but also our interventional radiology colleagues. We often have dual consultant operating because of the complexity of the patients, and a consultant interventional radiologist as well. There's lots of communication, lots of team working. We meet weekly to discuss all our complex patients and to review the scans and to make plans in place, and then we schedule patients according to who's around and how we need. So there's lots of thought that goes behind all of this.
And talk to me a little bit about the whole project. So the charity contribution has been for the equipment in here, which I think is the bit that makes it really hybrid and super. But the whole project itself, how much was the entirety of the project? And I know we've got some other spaces outside that are still being worked on.
So the whole project was approximately £7.8 million.
Wow.
But that included the principle behind the business case was that it took us from 10 theatres to 11 theatres. If you have an additional theatre, then you need additional staff. So you need an additional staff rest area, but you also need somewhere to recover the patients after they've had their operation. So it also included a new recovery area. So our new recovery area went into the old staff room. That's been completely repurposed. And then a new staff room has been built, which is a beautiful space for all of our staff to rest between their cases. So that was the whole big overall project. And the NHS England provided us with £5 million towards that project. And the trust also contributed to make it an extra theatre, but it was the charities that made us able to produce this super theatre to really make a difference so that it was fit for purpose.
So it's been a long journey in the making.
It has, and we're really lucky because so many vascular units across the country still don't have a hybrid theatre.
So, Hannah, what's next for the surgical team at the Royal Devon Trust?
So it's always a time of innovation and expansion. We've got the new recovery area opening in the next couple of months. And at the moment, the next exciting project is the development of the surgical hub over at the old Heathertree site, with 2 new theatres due to open towards the spring of next year. So that's the next new big project that we're trying to get open to help serve our patient population and give us a greater capacity to be able to treat more patients in a timely fashion and reduce all our waiting lists. So we're always looking for new members of staff to come and join the team, at whatever level. There's lots of exciting opportunities. We've got this beautiful high-tech theatre. We've got those new theatres opening. We've got multiple robots across the trust. So lots of exciting opportunities.
Yeah, and we've talked a bit about how close-knit you are as a team and how important that cohesiveness and teamwork is. Seems to me like a great team to join.
Absolutely. We all work really well together to treat our patients and give them the best care possible.
And I guess also from personal development, it's a great opportunity for people to come in and learn and work with this amazing equipment.
Yes, we've got opportunities here that you wouldn't get in other walks of life.
So Hannah, thank you so much. This has been such a rare treat for me to come and see this space, and it's amazing, and I'm not even the one who's getting to work in it. I think 18 months ago when we took on the challenge of raising 1.4 million for the equipment, I don't think any of us quite knew how we were going to do it. It seemed like such an insurmountable amount.
Absolutely.
And we've been bowled over by the generosity of the community and our donors and people who've really stepped up to the challenge. How does that feel for you and your team?
We are all ever so grateful. As you said, it is a phenomenal space and an absolute game changer for us and for our patients. So on behalf of all the staff and all the patients, thank you to everybody who donated. We wouldn't have it if it wasn't for them, so thank you.